Hello, I'm Dr. Dennis McKenna. Today I'm joined by Mr. John DePaula. John, welcome.
Thank you, Dennis. Good to be here.
Today is January 6th. That's Thursday, January 6th, 2022, and bringing you the update from Albany Med. So first of all, John, you do not have a mustache, so that's probably confusing a lot of people out there. Dr. Venditti is on a well-deserved time away, visiting, I think, his grandson for the first time.
That's exactly right.
Yeah, very good. And John has stepped in and is serving in the role of our hospital director, effective January 1st. John, off to a great start. Thank you very much.
Having lots of fun, Dennis. And really, you mentioned Dr. Venditti. He's absolutely been magnificent to me. Has really taken some time and mentoring me and guiding me. So I wish him a well-deserved vacation and well-deserved time off.
I bet he's watching us. So hello, Fred. And Happy New Year to you all. And Happy New Year to all of you as well. All right, let's jump into the graphs. First one is New York State. Obviously, everyone is aware that the number of cases of COVID are going up. These are the hospitalizations in the state. You can see we're currently at 10,867 within New York State, and we're watching that number very closely. Next graph is Capital Region, John. That is 351. And you participated today on the regional call, just like Fred used to do that. Right. You were on that today, and we were talking to the area hospitals, getting some feedback from them.
Exactly right, Dennis. And we're all going up in terms of number of cases and number of hospitalizations, and managing it as a region, in a very coordinated fashion. So
absolutely,
things are going well on that front,
as we have for the last 2 years. Next graph is admissions and discharges, specifically here at the medical center. The change is pretty obvious. If you look above the line, you can see admissions. That's gone from single digits to double digits. So we're seeing somewhere between 10 and 20 per day. Some days the admissions and discharges are matched evenly. Other days we have some more admissions and discharges. The good news is so far we've not gotten to the point where we're at our highest level. I'll talk about that in a second, but we're watching that very carefully. So next graph here, this is the morning census at Albany Med. We currently sit at 108. In the past, I've talked about our highest number. I think I've misstated that a couple times. I think I've said in the past our highest number was 165. In point of fact, the highest we ever were was 183. So that puts that 108 in perspective. Here's the breakdown. We have 93 on medical and surgical floors. We have 15 in the ICU. Right now, as of this moment, we have none on ventilators.
Wow.
Now, earlier in the morning, we had 5, so it looks like some have come off the ventilators. The other breakdown there of that 108, we currently have 100 that are adult, and we have 8 that are pediatric. So that's the breakdown. Also, John, in the last 7 days, we had 114 come in the hospital. People are often curious the breakdown, vaccinated, unvaccinated. So of the 114 that came into the hospital in the last 7 days, 71% of those continue to be unvaccinated. And then another thing which people have been talking about lately, we know the governor's talked about this recently, we've talked about this quite a bit, is the difference between coming in because of COVID or coming in with COVID. At the end of the day, if you're in the hospital and you have COVID, that's important because we may or may not need to treat it, but we definitely need to know about it. But it is important. We find somewhere between maybe right now 20 or 25% on some days come in with COVID. Let me say it that way, with COVID, not because of COVID. So what does that mean? Maybe I was in a car accident, maybe I had some other thing, I get tested on admission and I have it. So that's important because we have to make sure we cohort and wear protective equipment when we're in the room, but that is interesting.
It is fascinating, Dennis. And also just back to one of the items you called out, it's just interesting to see the significant drop-off with those patients that require ventilators down to 0. I mean, that's incredible. And also the number of patients that require ICU care. So those are tremendously positive trends.
They are, and so let's talk about that. So right now today, like I said, at this moment we have none on ventilators. I think we'll probably have a couple each day going forward. Most recently, when we had 5 on ventilators, that represented about 5% of all of the people in the hospital with COVID were on a ventilator. There was a point in the beginning of the pandemic where I went back and looked at this, where at one point back in April of 2020, about 46% of the people who were in the hospital with COVID were on a ventilator. So think about that. Almost half of the people in the hospital with COVID were on a ventilator. Now we're 5% or lower. Why is that? I think there's 4 different reasons for that. The first one is The variant that is out there, and we'll see a graph in a second, is Omicron, which we know is much more transmissible, but is thankfully much less likely to get you to the point where you're sick enough to be in an ICU.
Right.
The second thing is the vaccine, right? The vaccines work, they are safe and effective, and even if you do get a breakthrough case of this variant, the vaccine protects you from having the most serious side effects of that. Again, less likely to end up in an ICU or on a ventilator. The third thing is we have therapeutics, right? We have medications we can give either out of the hospital or in the hospital that prevent the most serious side effects of COVID. And the last is our staff. Physicians, nurses, respiratory therapists doing an amazing job managing this population.
They really are. They're amazing, and the unity that we're having, in our units, on our units, with physicians and doctors caring for patients in some really, really difficult circumstances. Yeah. I mean, it's quite remarkable. And again, Dennis, I'm just thinking about this now. It's been about a year now where you've been calling out for, just very simply, people to get vaccinated. And again, when you see the data and the number of patients that are here who are unvaccinated, I mean, it's just a no-brainer. I mean, people, if you haven't gotten vaccinated, please get vaccinated.
Yeah, we'll look at that graph in a second. So let's pop open the next graph here. What we're looking at is when we sample the different people who come in the hospital with COVID and what variant they have, you can see on this graph now, if you look all the way to the right, you can see that 96%, almost 97% of all of the variants in this area are now Omicron. And it took off pretty quickly, just like it did in South Africa. That number takes off pretty quickly in the last 2 weeks alone. So that is, in fact, what's driving most of that out there. And then let's look at this graph, John. Fred and I used to talk about this a lot. We call this our red, blue, black graph because we had 3 different lines on there. These are admissions to the hospital by vaccine status. And what you can see, quite frankly, on the bottom is the people who come into the hospital who are fully vaccinated. That line has been very, very low for a while. There's a slight uptick in that, so I think we have to call that out. So even those that are fully vaccinated, we're seeing a slight uptick in that, and that's just because of the total number of people that are testing positive. But the blue line, which is the unvaccinated, it's almost like a hockey stick function. You can see a significant pickup in the unvaccinated coming in over the last couple weeks, again, specifically driven by Omicron. And then the black line there, which is basically looking at the vaccine effectiveness, it still is measured at around 80%. So clearly the numbers would suggest that is something that, we encourage.
Yeah, and so much predictability there too, Dennis. I mean, when we saw the data in South Africa and felt it was going to be very similar to what's happening here, we're following, right along those trend lines. And again, it's been a year now with vaccination and the benefit of it. Again, there's just more data and evidence that's overwhelming to get vaccinated.
No question about it. We were hearing today that what we're seeing in the hospitals now is different than it was, say, perhaps a year ago. It was a heavily focused ICU and ventilator illness in the beginning. It is primarily now moving more towards a med surg or in some cases an outpatient. Obviously, we thank everybody who works in our critical care units. Once you land there with COVID, those people do incredible work. Yeah. But thankfully, less are requiring that level of care, more on the floors. All right, let's pop open another graph here. Let's look at length of stay in the hospital. And again, what's really interesting here is they're both coming down. But again, this ties back to COVID. Because when you were in the hospital a year ago with COVID, your length of stay was about 14 or 15 or even more days at times. Most recent data done by Matt Cerf in our analytics department shows that your length of stay in the hospital if you have COVID is closer to 8 days. So the good news is as that comes down, our total length of stay goes down. John, you're leading us through Incident Command, which is looking at staffing and COVID. A lot of effort still in the area of length of stay, correct?
Definitely. We're really focused on that initiative. It's getting challenging from the standpoint of staffing, and we're making there's incredible work going on in the institution right now in sort of managing staff and directing staff where we have our needs to take care of patients. And really a credit to our clinical managers, operational managers. They're doing a remarkable job meeting on a daily basis to really align our staffing resources to where they're needed most.
So to that point, we know, obviously, because people have been watching the news, they've been reading the newspapers, they work here, they talk to people in the community. As the number of people who are testing positive goes up, even among those that are vaccinated, that's impacting our workforce as well. Obviously, we want to provide safe care. We follow very strictly the rules put out by the CDC and the local health departments about who can and cannot work. And there's criteria by which, if you're an essential worker, if you're a healthcare worker, you can return back into the hospital setting after a certain number of days and certain criteria that need to be met. John, you were talking to somebody recently who was out for a few days, who was back, and I thought it was really interesting insight into their mindset. Go ahead, tell the story.
Dennis. Yeah, I was doing some senior leader rounding in our OBGYN outpatient clinic over at 391 Myrtle Avenue. And I just walked up to a nurse and asked her how she was doing. And she said to me, she said, well, I'm just getting back from being out from having COVID. And you know, she was tremendously upbeat, which was great to see, and feeling better. And she actually was very complimentary about the process that we have here, where we reach out to our staff, inquire how they're doing, and want them to come to work when they're feeling better and can return to work safely. And she was very complimentary about how supportive the process was, and it was good to hear that and share that with our management leaders as well.
Yeah. And I would say, like, the overwhelming majority, I would say probably close to 99% of the individuals who are workforce who do test positive, they never need to be admitted to the hospital. It's a couple of days at home, and when it's safe to come back, they're back. So that's great. Yeah. John, there was a booster clinic today. I think it was Moderna, and obviously we're encouraging our workforce to get the booster. And I think you, among other people, have been leading the effort to have more booster clinics here on campus. What can you tell us about that?
Yeah, it was a great day. Lots of success. There were over 500 of our staff that received their booster vaccination today with this clinic that we put on. Really credit to a lot of people in our pharmacy area and our laboratory area. So tremendous success. And to your point, Dennis, we are going to do more of these types of vaccination clinics. So there will be more coming. So we encourage staff to keep an eye out in all of our communication efforts and our messengers to know when these clinics are coming. And also, we're going to reach out and go right into our units and start giving booster vaccinations right on our various units. So a lot more to come on that front in the coming weeks.
I think if we can do more of that, that would be great. I know a lot of people are busy, they're taking care of patients. If we can bring the vaccine to them, I think that'd be fabulous. So I would definitely encourage that. Obviously, I mentioned Incident Command. It's the way we're managing the dual crisis of both COVID as well as staffing. John, you've jumped right into that lead seat with Scott Heller and the team that you're leading. Any insights into that?
Yeah, it's a great team effort, and really epidemiology, nursing, our medical leadership, logistics, human resources. It's a combination of all of those leaders coming together to really try to manage this process, manage the uptick that we're having with COVID patients, at the same time trying to deal with our staff getting COVID and managing that process as well. So really effective leadership that's going on right now by all of our managers, and we can't thank them enough for the incredible work that they're doing.
Yeah, and you're doing a great job too, John.
Thank you, sir.
You really are. A white coat ceremony recently. This is for our physician assistant program here at Albany Med, something we're very proud of. We have the only such program in the entire region. Physician assistants are a huge part of our workforce, and obviously we're so proud to educate them. What is the white coat ceremony? What's that mean, John?
So from the standpoint of, these are all of our newly admitted students that are, yearning to become PAs, and it's their sort of commitment by getting that white coat with their first day here, that they're going to follow the processes and complete all of the academic requirements to ultimately become PAs and wear that white coat upon graduation. So it's an incredible ceremony that gets done. Nate Gardner is the leader of our PA program and has a tremendous group of faculty, and they really do a great job training these students and prepare them to become clinicians in the coming months.
Very, very competitive to get into our PA program. Great faculty. Congratulations and welcome to the class of 2024. Yeah. Some great news. Our Breast Cancer Center has been accredited by the American College of Surgeons. That's the highest level of accreditation you can get, and really a stamp of gold star approval for all the care that's delivered there. So congratulations to everybody involved in that, for sure. And lastly, John, we just recently passed a system-wide financial aid policy. This is another example of the Albany Med Health System working together. These are the 4 hospitals of Albany Medical Center Hospital, Columbia Memorial Hospital, Saratoga Hospital, and Glens Falls Hospital, all working together. We have a singular financial aid policy now, and it's another example of system work together so that the experience for the patient who enters our system is the same everywhere. And if you want to learn more about that on this campus, it's amc.edu/FAP, which is financial aid policy. I think that'll do it.
Great stuff, Dennis. That was a lot.
That was. Are you going to grow a mustache?
I'm sorry. I've never had a mustache my entire life.
How about?
I'm sorry to disappoint you.
No,
You
no,
and
no.
Fred, I
no,
can't make that
no.
happen.
I know I'm not going to. Only Fred can pull that off.
That's right.
Yeah. Anyway, glad to have you here. Thank you so much.
Dennis.
All
Always
right,
good to be here.
Well, we flipped into 2022. We picked up right where we left off. A lot happening. We thank our workforce. Senior Leader Rounding is occurring every day. We're out on the floors. We're looking forward to seeing you, seeing more of you, being out there, thanking you for everything. We need you now more than ever, and we truly appreciate everything you're doing. So we'll be back again next week. John, we'll see you soon. Thank you very much.
All right,
We ask
Dennis.
that you once again please take care of yourself, take care of each other, and we'll see you next week.